Good morning, everyone. I'm Ichi here. I'll be your facilitator for today. And then today we are going to learn BLS, basic cardiac life support. And then I'm from Singapore. And then I've been working in a hospital for like 10 years. I've been to emergency department and cardiac department before. Okay, so let's introduce one by one. First, maybe start with you. What's your name?
My name is Claudia.
Claudia. You are from which department?
Medical ward.
Medical ward. You are internal staff. Okay. You are? Abby. From where? ICU. Okay. Oh, baby. No makers. Okay. You are?
Mr. Lim, I don't want the email here. Mr. Lim, alright.
Okay. Okay. And he's an external.
External trainer. No, trainer.
You are?
My name is Anis.
Anis.
I'm from radiology department.
Radiologist. You are
Radiographer.
radiographer.
Yeah.
Okay. Hi, you are?
My name is Pauli here.
Pauli.
From medical ward for directors.
Okay. So today we will 8 a.m. we will start the course, and then at 8:05 to 8:35 we will be teaching one rescuer adult BLS, and then from 8:35 it will be AED and back mask device. Then 8:55 to 9:04 it will be two rescuer adult BLS. Then 9:04 it will be a special condition. So we will be showing videos on mouth-to-mouth breath, rescue breath, breath with an advanced airway, avoids associated life-threatening emergency or maternal cardiac arrest. Then at 9:15 it will be we will showing a video on high performance team and team dynamic. Okay. Then at 9:40 it will be a local protocol discussion. I don't think we will be doing that. So at 10 o'clock it will be your break. Then it will be a 10 minutes break now. 10:10 it will be we will be showing you a video and practicing on child BLS. Then 10:20 infant BLS. Then 10:40 relief of choking. 10:47 it will be a conclusion, and 10:50 it will be a skill test. So there will be an exam at the end of the day. Then so in order to pass this course, you have to pass two tests. One is the skill test, another one is the theory test. Theory test you have to pass above 84%. Yeah. Any question? Have you had your breakfast?
Any rock paper to write? We got no rock paper.
You all have your face, the face mask. Yeah.
Yeah.
Thank you.
Heart disease is the #1 cause of death in both men and women globally and claims more lives than all forms of cancer combined. Cardiac arrest may be caused by almost any known heart condition and is often fatal if appropriate steps aren't taken immediately. Cardiac arrest does not discriminate. It can affect all ages, genders, nationalities, and races. This is why early recognition and immediate cardiopulmonary resuscitation, or CPR, are crucial for survival from cardiac arrest. Healthcare providers are the backbone of the systems of care in both the community and medical facilities. Advanced rescue measures cannot be successful on their own without solid basic life support, or BLS. This training will guide you through the key practices of high-quality BLS.
Products are shown for demonstration purposes only. The AHA does not endorse or recommend any specific manufacturer or product. In order to show skills clearly, the healthcare providers in this video do not always use recommended personal protective equipment such as gloves. The AHA's mission of saving lives is a global initiative. The AHA recognizes that heart disease is the #1 killer of both women and men. However, most skills in this video will be demonstrated on male victims to respect global awareness and cultural sensitivity. Encounter a victim of cardiac arrest. On any given day and at any time, you can encounter a victim of cardiac arrest because about every 90 seconds, a person dies of sudden cardiac arrest. But with the training you receive today, your actions can give a victim the best chance of survival.
Sudden cardiac arrest occurs without warning or within just a few minutes after symptoms appear. The term heart attack is often mistakenly used to describe cardiac arrest. Although a heart attack may cause cardiac arrest and sudden death, they are different conditions. But it's important to call emergency services for both. There's more information on the differences between heart attack and cardiac arrest in your provider manual.
First, let's talk about the 2 adult chains of survival. One is for out-of-hospital cardiac arrest, and one is for in-hospital cardiac arrest. The 2 chains have 6 links, but the links differ slightly. Both chains include activation of the emergency response system, high-quality CPR, early defibrillation, post-cardiac arrest care, which may be provided in the cath lab or the intensive care unit, and recovery.
For the out-of-hospital chain, the difference is the 4th link, which focuses on advanced resuscitation. In this link, a multi-rescuer team arrives and takes over CPR and may perform additional advanced interventions. For the in-hospital chain, the difference is the 1st link. It focuses on early recognition and prevention of cardiac arrest with patient monitoring and assessment, and, if necessary, rapid response by the medical emergency team when a patient's condition starts to deteriorate.
Now, let's review the links in the out-of-hospital chain of survival as they could happen in a real-life resuscitation event. It's a normal day at the airport. A woman notices that her husband is not looking well. When he collapses, she immediately calls for help, and a security guard rushes over. The guard gets no response and sees no sign of breathing, so he directs a coworker to activate the emergency response system. The out-of-hospital chain of survival begins right here, with the guard's immediate recognition of possible cardiac arrest and activation of the emergency response system. A rescuer must recognize that someone is in cardiac arrest. This person will have signs such as unresponsiveness and lack of normal breathing. After recognition, the rescuer should ensure that the emergency response system has been activated and begin high-quality CPR. Effective bystander CPR provided immediately after cardiac arrest can double or even triple someone's chance of survival. Bystanders who aren't trained in CPR are encouraged to provide compression-only CPR, also called hands-only CPR. When an untrained bystander sees an adult collapse suddenly, there are 2 simple steps to follow. Call 911 and push hard and fast in the center of the chest. Dispatchers or telecommunicators may provide further instructions, including step-by-step coaching on how to perform CPR until trained help arrives.
Some rescuers might find it necessary to provide compression-only CPR until a barrier device is available. The guard begins chest compressions without delay. A second guard returns with an AED. This introduces the next link in the chain of survival. The AED, or Automated External Defibrillator, is a lightweight portable device that can identify an abnormal heart rhythm that needs a shock. The AED can then deliver a shock that can convert a rhythm back to normal.
Most sudden cardiac arrests are triggered by abnormal heart rhythms called arrhythmias. A common and treatable arrhythmia causing cardiac arrest is ventricular fibrillation, or VF. With VF, the heart's electrical impulses suddenly become chaotic and ineffective. Blood flow to the brain and other vital organs stops abruptly, and the person loses consciousness. Death usually follows unless a normal heart rhythm and pulse are restored within minutes. The AED uses voice prompts, lights, and on-screen messages to tell the rescuer the steps to take. AEDs are simple to operate, allowing lay rescuers and healthcare providers to attempt defibrillation safely.
As the emergency medical services, or EMS providers, arrive and take over care, they provide advanced life support, extending the chain to give the person the best chance of survival. Advanced life support can occur in any setting and provides more advanced treatment.
Once the return of spontaneous circulation, or ROSC, is achieved, EMS transports the person for post-cardiac arrest care. Post-cardiac arrest care after ROSC focuses on preventing the return of cardiac arrest and improving long-term survival. Recovery from cardiac arrest continues long after hospital discharge and includes physical, emotional, and family support. These 6 links show the most important actions needed to treat cardiac arrest.
BLS is the foundation for saving lives after a cardiac arrest. In this course, you'll learn the skills of high-quality CPR for people of all ages and practice delivery of these skills, both as a single rescuer and as a member of a multi-rescuer team. Now, let's go back and review a rescue, focusing on the steps of BLS as they happen.
There are several steps of BLS that you'll need to perform when you suspect that a person is in cardiac arrest. First, scan the scene to assess safety. Then, check to see if the person is responsive by tapping and shouting. If they do not respond, activate the emergency response system and get an AED, or send someone to activate the emergency response system. Next, check for breathing by watching the chest for rise and fall.
Abnormal breaths are common in the first minutes of a cardiac arrest. These abnormal breaths are called agonal gasps and should not be confused with normal breathing. Rescuers can sometimes mistake agonal breathing for normal breathing and fail to recognize cardiac arrest and initiate CPR. Seizure-like activity can also sometimes delay the recognition of cardiac arrest.
If the person has no signs of responsiveness, the emergency response system has been activated with an AED on the way, and there are no signs of breathing or a pulse, then immediately begin CPR starting with chest compressions. The delivery of rapid, strong compressions is a priority, but be sure to deliver ventilation as soon as the pocket mask or bag mask device arrives. Once the AED arrives, it is important to use it immediately. We will go over proper AED use later in the course.
You never know what situation you'll face or what resources will be accessible. It's important to have the knowledge and a framework to provide high-quality, life-saving CPR regardless of the conditions and circumstances.
Now we will focus on the individual skills that rescuers perform. It is most effective to perform CPR as a team, but to be an effective team member, you'll need the individual skills of CPR. So we'll start there.
As a healthcare provider, your first step is to assess the surroundings for safety. Then, tap and shout to see if the person responds. If not, you should shout for nearby help or activate the emergency response system in your workplace. Check for breathing by scanning the person's chest, looking for chest rise. Check for a carotid pulse. The technique of feeling for the carotid pulse is usually easier to perform on the side closest to you. Use 2 or 3 fingers to locate the person's trachea, and then slide your fingers into the groove just to one side of the trachea.
You can scan for breathing and check for a pulse simultaneously to minimize time before compressions. The check for breathing and pulse should take at least 5, but no more than 10 seconds. If you observe no breathing, abnormal breathing, or only gasping, and you do not feel a pulse, ensure that help is on the way and start chest compressions immediately.
Before you start chest compressions, make sure the person is lying face up on a firm, flat surface. If you need to remove clothing to expose the person's chest, do it quickly. You need to work with a bare chest because later you'll attach the AED pads to bare skin.
By starting compressions, you are initiating the CAB sequence, or compressions, airway, and breathing sequence. In the first few minutes of a cardiac arrest, there is still oxygen in the bloodstream. Starting CPR with chest compressions can pump that oxygenated blood to the brain and heart. After you give compressions, open the person's airway and deliver breaths. It's important to minimize interruptions in chest compressions to 10 seconds or less. Each time you stop compressions, the blood flow to the heart and brain decreases significantly. When you resume compressions, it takes several compressions to increase blood flow to the heart and brain back to the same levels. So any interruption in chest compressions can result in low blood flow and minimize the chance of ROSC.
To begin, place the heel of one hand on the center of your mannequin's bare chest, over the lower half of the breastbone. Place the heel of your other hand on top of the first. Make sure that your shoulders are directly over your hands with your elbows straight. And when we start, remember to push straight down on the breastbone to get adequate depth. When you push, push hard and fast. There is some evidence that compressing too deep can increase injuries from CPR. However, a larger problem is that most providers don't compress deep enough. So focus on making sure your compressions are deep enough. Compress at a rate between 100 to 120 per minute while counting out loud, making sure the compressions are at least 2 inches or at least 5 centimeters deep, and allowing the chest to recoil after each compression. We recommend using a feedback device that provides real-time corrective feedback on CPR quality regarding rate, depth, and chest recoil, not just when performing CPR in practice, but also in your workplace. We'll talk more about feedback devices throughout the course, and you will complete some practice and testing with them later.
You can follow along with what's on the screen as you perform compressions yourself. You'll perform 3 sets of 30 compressions after you assess the scene. We'll pause here while everyone gets into position.
So just now they have mentioned a few high quality CPR. So can you tell me what it is? Push hard, push fast. How hard? How deep? At least 5 cm. Okay, how fast? How fast? How many compression? Yes, very good. 100 to 120 compressions a minute. Any more that they have mentioned?
Slightly deep now, but make sure there's no injector.
Full recoil. Make sure there's a full recoil every time you compress. Okay, then what else? Actually there's some changes to the previous one. Rescue breathing, right? If the casualty has pulse but no breathing, so we are going to give rescue breathing. How much is the rescue breathing? Every?
Baca buku dah orang. Baca buku dah.
Every yes, every 6 seconds, 1 breath. Okay, so regarding the BLS assessment, so what do we check for first?
Safety.
Yes, check for safety. Then what?
Buat digoreng. Digoreng.
Let's see.
Check for
Okay.
respond. How do you check?
Back the shoulder.
Very loud you must do. Don't it, sir, tak boleh Sir, are you okay? Very loud to alert the person. It could be deeply asleep or something like that, right? So alert. And then next one?
Okay,
No
then
response?
No response.
Good.
Shout for help. Okay, call.
So, in case you are alone, pasal tidak orang kan, lagi keras menjerit. Help, tolong. Pasal apa? Orang dalam kaki satu orang. Dan lepas tu, what do you do?
Check. Scan. Chest.
For
Any breathing.
breathing and
Pulse.
At the same time.
sambil.
For how long?
At least 5 seconds, but not more than 10 seconds.
10
Very
seconds. Very good.
good.
Okay.
So all this kena ingat step dia. Very important.
So the chain of survival, there's 6. Last time there's 5.
Where's the book? Have the book in front of you. You all must have the book in front of you, please. Make sure they have the book in front of you. Book for them to look through. What page is that?
6.
Look at open page 6. Rantai penyelamatan dia. Kan? Dulu sebelum before this new guideline ada 5 saja rantai dia. 5 page 6. 5 kan? Last time up to here only. So what is the additional there? What is the additional? Huh?
Advanced exercise.
No, additional.
Recovery.
Recovery.
Yes.
Yeah. So recovery.
Explain to them what is recovery.
So recovery will start when they achieve ROS lah. So the recovery focus on psychosocial, psychological of the patient and the family.
Sorry, just now was the rose I mentioned.
Huh?
The name for rose, acronym for rose.
Return of spontaneous circulation.
Okay.
ROS kan? ROSC.
Yeah, yeah.
ROS. Return of spontaneous circulation.
Any more questions?
So why, I just want to add in, why this additional chain is important? Do you know why? This is the last one, recovery. Why? Tell me, speak up. We are here to talk about. What is it? You go. Huh? Of course, yeah, it can happen again if the patient doesn't have proper follow-up, proper education, family support. Basically, recovery ni kan, post cardiac arrest, right? After ROS, then kata patient sudah treat okay already, discharge already, balik rumah. Kadang-kadang patient tengok yang okay already, they just don't follow anything, and then they could have another heart attack. And basically because of these are the survey they've done, so you have to give proper support, emotional, psychological, and family support. Katalah okay, dia balik rumah, okay, make sure you take medication properly, exercise, eat proper food, follow up the doctor. All these are important things. Sometimes people don't follow up. They say, oh, I'm better already, what? After heart attack, I'm okay already. Dan dia orang tak ikut. Kadang-kadang ada lah orang macam ni kan. That's why sometimes the death occurs earlier. So we need to educate them. Itu maksud dia. Yang lastnya. Okay?
I think they can
Yeah, come
each
forward here.
take one medication. With the pocket mask, yeah.
Your high quality CPR must be your take home point. Important thing. You take the lead.
Just take a lead one.
You take the lead. Face the screen.
So at the mannequin left side, right, of the shoulder, when you compress, there's light. So we like
Coba compress. Coba compress.
two green.
Center of the chest. Kuat. Ada pukul. Kena ada dua lampu yellow. Then only is correct, bagus. Kalau macam tu laju, macam tu laju.
Maybe that's
Yang kena ada nombor
It is,
2. Kalau ada satu macam ni, kalau slow. Okay, Kak.
yeah, if you didn't see the two green
Ah,
light,
maintain
you
the
can
two
use
yellow.
fast. Like the flashing yellow light, right?
Yours
You
is
can use too
consistent.
fast.
Yellow must be yellow.
Wrong position.
Too yellow.
Too
Okay, that's
shallow.
Too fast.
Yeah.
Go ahead, adjust yourself.
So you must remember the rhythm later.
Bring your knee a bit forward better. Always when the compression must be nearer to the victim, nearer. Push harder. Some, there, good. And then don't too fast.
Not,
You will adjust
sometimes
yourself.
not speed enough or too fast, too slow.
You see here, when you get to yellow means you are pushing at what? 5 centimeter.
Yes.
Betul?
Yes.
Okay, so work for it.
Remember
Okay.
the rhythm. I play the video, your
Follow the technique. Okay, stop. Ini saja bagi orang tahu saja.
On any given day, and at
So play.
Scene safety. Okay, follow the video. Scene safety tadi orang cakap kan? Macam mana start?
Okay, let's begin. In
Start.
3,
Scene safe.
2, 1.
Scene safe.
Scene safety.
Scene safe. Next. Follow.
Hey, are you okay? Are you okay? Help, someone help.
Oh, then
Check the pulse.
we short first lah.
Check the pulse and
Check
check the
breathing.
at the same
Breathing.
time.
Same time.
Activate the emergency response and get an E AED.
Now we call someone. Someone comes in. Sir, you.
Yes, sir.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16,
Two yellow
17,
line,
18,
yellow line
19,
there.
20, 21, 22, 23,
What
24,
line?
25, 26, 27, 28,
You first thing you
29,
need to
30.
try and verify. You understand? Follow me.
1, 2, 3, 4,
Count, count.
5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay, now you got it already, yeah? So, very important, huh? The depth is very important, huh?
And
Okay.
remember the rhythm.
Ah.
Yeah, don't need to be too fast or too slow.
So now, let's go through the use of pocket masks, and then we'll practice one rescuer's skills with compressions and breaths. When you're working, you'll likely have access to a bag mask device. However, because a cardiac arrest can happen anywhere at any time, it's important to be comfortable and effective with a pocket mask. A bag mask device might not be too far away, but when minutes and seconds matter, the time saved by being proficient with a pocket mask is invaluable. We'll use a pocket mask for the one rescuer activity in our training today.
When the guard finishes a cycle of compressions, he quickly places the mask with the one-way valve on the person's face. He delivers 2 breaths and returns to giving compressions immediately to minimize interruptions in chest compressions to less than 10 seconds.
Now let's examine the technique. Place the mask on the person's face, using the bridge of the nose as a guide for correct positioning. Seal the mask against the face by placing the index finger and thumb of your hand that's closest to the top of the person's head along the edge of the mask. Now, place the thumb of your other hand along the lower edge of the mask. Then, place the fingers of that hand under the bony part of the lower jaw near the chin, taking care to avoid the soft tissue under the chin. After that, open the airway by using a head tilt chin lift. By lifting the jaw to bring the chin forward, you'll lift the person's tongue away from the back of the throat, relieving a possible airway obstruction. Press the mask down while lifting the jaw to hold the mask tightly against the face, and give 2 breaths while watching for slight chest rise. Actually seeing the chest rise with each breath is the best way to ensure that your breaths are effective. Breaths should be delivered over 1 second each, with just enough force to produce visible chest rise. Avoid excessive ventilation and pause about 1 second between each breath.
In this practice session, be sure to hold the mask firmly against the face while lifting the jaw. Also, watch for the chest to rise as you deliver each breath over 1 second. We'll pause here for you to get into position with the mannequins to practice the technique of opening the airway and giving breaths by using your pocket mask with a one-way valve. We'll practice 5 sets of 2 breaths along with the video.
So now, let's
Get ready. Begin in 3, 2, 1. Give 2 breaths. Watch for chest rise. Give 2 breaths. Give 2 breaths. Give 2 breaths. Give 2 breaths.
So we give the breath until there's a chest rise. Do not, one of the high quality CPR is also do not have excessive ventilation.
Get ready. Begin in
Now let's practice compressions and breaths together by using your pocket mask with a one-way valve. When switching between giving compressions and giving breaths, limit the time between compression cycles and breaths to 10 seconds or less. Make sure the chest rises with each breath, but provide ventilation just to the point of the chest rising. We'll start with assessment and then combine compressions and breaths. We'll be doing 3 sets of 30 compressions with 2 breaths. We'll pause here while you get into position with the mannequins.
Another high quality CPR they mentioned here is also minimize interruption, less than 10 seconds.
Now let's practice compressions and breaths together. Here we go, in 3, 2, 1.
Hey, are you okay? Are you okay? Help, someone help. Activate the emergency response and get an AED. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Just simulate, ensure there's chest rise.
Here we go, in
So now we are going to learn AED.
When participating in a resuscitation event with rescuers from multiple agencies, the real challenge becomes about logistics. In other words, the coordination of rescuers and resources when more people are involved. However, your first few steps are the same.
When you arrive, quickly assess the scene and try to get a response from the victim. If there is no response, call for help or activate the emergency response system. Then take 5, but no more than 10 seconds to check for breathing, looking for signs that the person is not breathing or is only gasping, and at the same time, attempt to find a pulse.
Move the victim to a firm, flat surface and begin CPR. One rescuer should start compressions while the second delivers ventilation. After each set of 30 compressions, the ventilator should deliver 2 breaths. A third rescuer should turn on the AED and attach the pads to the victim's bare chest. It's important to know your AED or defibrillator because models can differ. Follow your device's prompts for the next steps.
When the AED signals that it's ready to analyze and that all rescuers must stay clear of the patient, the compressor should switch roles with another rescuer. While the AED is charging, the compressor should take advantage of that time to deliver a few more crucial compressions.
The emergency responder operating the AED is responsible for ensuring that all rescuers are clear from touching the patient to allow for rhythm analysis and before delivering a shock. If a shock is advised, clear everyone and deliver the shock.
As soon as a shock is delivered, rescuers should begin another set of compressions, with a different rescuer delivering compressions, and with a feedback device now in place. Continue these steps until advanced help arrives.
Now let's focus on using an AED. Although AEDs may differ slightly, there are 4 universal steps for operation. To begin, turn on the AED, open the carrying case or the top of the unit and immediately power on the AED. Some devices will power on automatically when you open the lid. After that, attach the pads to the victim's bare chest. Use the diagrams on the pads for correct placement. Some AEDs may have adult and pediatric pads. Be sure to use the adult pads on anyone 8 years of age or older. If you're not sure of the person's age, use the adult pads. On some AEDs, you may need to plug in the pads if they aren't already connected.
After you open the device and power on the unit, follow the prompts and place the adhesive pads on the person's bare chest per the pictures on the pads. Place one pad to the side of the left nipple and the other on the upper right chest, directly below the collarbone. After the AED is turned on, some units will tell you to press a button for the device to analyze the heart rhythm. Others will analyze the rhythm automatically. The AED may take about 5 to 15 seconds to analyze the rhythm.
The AED will deliver an audible prompt when it's ready to analyze the heart's rhythm, followed by a prompt to clear the victim. Strongly repeat the command to clear, checking visually to be sure that all rescuers and bystanders receive the command and follow it. Once the AED completes its analysis, if a shock is advised, it will charge and then prompt again to clear the victim. You'll repeat the command to those nearby. Loudly state something like, "Everybody clear," and visually check to make sure that nobody is touching the victim, not even the person in charge of giving breaths. Then, the shock can be delivered.
Next, press the shock button. The shock may produce a sudden contraction in the victim's muscles. After the AED gives the shock, resume CPR immediately, beginning with chest compressions. Do not remove the AED pads or turn it off. The device will repeat the analyze and shock cycle about every 2 minutes. Follow the AED's voice prompts. If at any time the AED indicates that no shock is advised, immediately start chest compressions.
You'll need to consider a few special situations when using an AED. First, if the person's chest is so hairy that the pads can't adhere to the skin, you may quickly shave the area if a razor is provided. If no razor is provided and you have 2 sets of pads, apply 1 set to the hairy chest. If the chest hair prevents the pads from contacting the skin, the AED should tell you to check the pads. If it does, press them down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then apply a new set of pads to the bare skin.
Excessive water on the victim's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the victim's heart. If a victim is lying in water, quickly move them to a dry area before using an AED. But if the victim is lying on snow or in a small puddle, you can use the AED. And if the chest is covered with water or sweat, wipe it off before attaching the AED pads. But wipe the chest quickly. It doesn't have to be completely dry.
Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like a round or square lump that's smaller than a deck of cards. If you see this lump, avoid putting a pad directly over it. Also, don't place a pad directly over a medicine patch. If a medicine patch is located where you need to place a pad, take the patch off and quickly wipe the chest before applying the pad. If the victim is wearing an undergarment containing metal, be sure to apply the AED pads on bare skin, avoiding contact with the garment.
You should familiarize yourself with the AED model in your workplace. Regardless of the type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. AED kits may include additional emergency equipment, such as scissors, razors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit.
We'll pause here to allow you to get familiar with the AED in your class today. Your instructor will show you all that's included in the kit and demonstrate the correct way to place the pads on a victim.
So when you get the AED, what do?
Turn on first.
Yes, turn on. Okay, then follow the instruction. Okay. So when analyzing the rhythm, what do? Yeah, ask everyone to stay clear. Okay. When they ask you to shock, how? Now you do.
Everybody clear.
Yes, everyone clear. Everybody clear. Okay. So when the shock button is blinking, it tells you to shock lah.
Yes.
If it's not blinking, then no need to shock. Okay? So, another question I want to ask you, it might come out in the theory test. So where do you put, when you do compression, where do you put your palm of your hand? No, it's not middle. Lower half of the sternum, lower half of the breastbone. Okay? So, okay. So if the patient has got hairy chest, what do you do?
Shave.
Shave. Okay. So just now there's the video asks you to rip off the pets, right?
Yes.
So try not to do that because the pets is very expensive.
Yes.
Yeah. So in the end, the patient didn't make it. Then the family member might complain or something. Why so expensive? So if there's water, what do you do? Yes, very good. You clean it or wipe it lah. So if there's a pacemaker, yes, do not put on top of the pacemaker. So if there's a medical patch,
Remove one in the face.
yes, if there's remove the medical patch and clean with the cloth, right?
When participating in a resuscitation,
Providing effective ventilation is critical to successful high-quality CPR, especially in respiratory-related emergencies such as drowning, anaphylaxis, and asthma. Guidelines recommend against excessive ventilation during CPR, and research suggests that some rescuers are less confident and less effective when using a bag mask device on their own without assistance. Because using a bag mask device is such an important skill and is common in the healthcare setting, we'll work on it now. Bag mask devices consist of a ventilation bag and a face mask, and they come in a variety of sizes. You can also use supplemental oxygen with a bag mask device.
to begin, position yourself directly above the person's head. You'll use the EC clamp technique to hold the mask in place. To do this, apply the mask by first placing the cushion at the narrow end of the mask onto the bridge of the person's nose. Then lower the mask fully onto the face, watching for the cushion to bulge as it initially seals against the face. Form a C with the thumb and index finger of one hand and press down on the dome of the mask toward the face to further seal the rim of the mask. The remaining 3 fingers of that same hand should form an E to reach past the edge of the mask along the bony rim of the jaw. To tilt the head back, lift the jaw toward the mask and open the airway.
Make sure you squeeze the mask with your thumb and index finger while lifting the jaw to achieve an airtight seal between the mask and the face. And squeeze the bag with your other hand or push it against your leg or body. If the chest doesn't rise with each breath, you're not providing adequate breaths. If you don't get chest rise, readjust the mask, reposition the head and neck, and try again to ventilate. And then, only if necessary, administer a larger amount of air, just enough to get chest rise.
The critical points of delivering breaths remain the same for the bag mask device as for the pocket mask. 2 breaths are given, with each breath given over 1 second after every set of 30 compressions. Be sure to deliver each breath over 1 second with just enough volume to make the chest rise. Delivering breaths in this way will reduce the chance of gastric inflation, or air going into the person's stomach instead of the lungs. Gastric inflation can cause vomiting and possible aspiration.
If you have multiple rescuers, the most effective way to deliver breaths with a bag mask device is to use the 2-person technique. One rescuer focuses on keeping the airway open and securing the mask, while a second rescuer squeezes the bag to deliver breaths, just enough to cause the chest to rise. The first rescuer will use both hands to seal the mask to the person's face and lift the jaw. The thumbs and index fingers of both hands each form a C to seal the mask against the face, and the 3 remaining fingers of each hand will form an E for lifting both sides of the jaw into the mask. Be careful not to press too hard on the mask, which could push the jaw down and block the airway.
Now it's time to practice the one rescuer bag mask technique so that in a few minutes, we can combine it with compressions to work on a two rescuer sequence. We'll pause here to get into position. Now that we're ready, let's practice using the bag mask device. Follow along with the video. Here we go in 3, 2, 1. Give 2 breaths. Watch for chest rise.
Chest rise.
Give 2 breaths.
Chest rise. Chest rise.
Give 2 breaths. Give 2 breaths. And give 2 breaths. Now that
Yes, yes, yes.
If let's say in the real case, you take out the head, like the back mask, the head will come down again. Now we have to take CD, right? In real case, it's on the first side. So,
Of course, the head will go back to position.
so
In normal, dia macam ni kan. You not, when you lift up, you opening the airway ni, saluran pernafasan. So you have to, but in the real life, this is mannequin. This is showing. Unless you lift up the left, the airway open. Okay? In real life, you must tilt the head. If you let go, then just go back down.
So when there's a two-man, right? Two-man rescuer, one is doing the compression, another one is putting, if there's no face mask or pocket mask, then the person has to maintain head tilt chin in. Or if there's a back mask, right, then put a back mask, stand by there, then maintain head tilt chin in.
that means when we, the other guy is rescue doing a compression, right? So is it the mask must always be tight here or you have to let go when you do the pumping?
The mask must be there now. Yeah, try to be there.
Or the mask always is here?
Yeah.
Okay, okay.
Right. And maintain head tilt chin in also.
Okay, okay.
Okay, so now we are doing a two rescuer. Maybe you join one of them. Yeah, you can join them.
Oh, I want to see the spin, right? Okay, I go there.
So rotate lah. Now rotate.
I think.
sometimes treatment for a cardiac arrest may be delayed, either because of barriers to accessing the victim or because the arrest was not witnessed. Regardless, CPR is still critical.
The earlier a victim of cardiac arrest receives CPR and shock delivery, the greater the chance of survival and recovery. And early CPR has been shown to double or even triple survival from witnessed sudden cardiac arrest.
For many healthcare providers and other rescuers, the two-person or team rescue is a more common occurrence. So let's first look at the roles for two-person rescues.
The first rescuer should begin CPR with chest compressions while counting out loud and delivering breaths. Basically, they're handling the situation at first as a one rescuer scenario. The second rescuer is responsible for powering up the AED and attaching the pads, as well as providing ventilation when a device becomes available. It's important to remember that the rescuer performing compressions should switch roles about every 2 minutes to avoid fatigue and ensure that compressions remain effective. The compressor should pause when ventilations are being given until an advanced airway is secured. The compressor may also need to briefly pause when the advanced airway is inserted. And if you're performing CPR without an AED, you should switch roles when fatigued or after every 5 cycles. That's about every 2 minutes. When an AED is present, switch roles every time the AED tells you to reanalyze, or sooner if the compressor is fatigued. This switch should take less than 5 seconds to minimize interruptions in chest compressions. We'll learn more about how to effectively switch roles in the team dynamics section.
In 2 rescuer CPR, each rescuer has a specific role. Let's review these roles while watching them play out. Rescuer number 1 should be positioned at the person's side, ready to perform chest compressions and count them out loud. And rescuer number 2 should be positioned at the person's head. It's rescuer 2's role to maintain an open airway and give breaths with a bag mask device while watching for the chest to rise and avoiding excessive ventilation. Rescuer 2 should also encourage rescuer 1 to perform chest compressions that are fast and deep enough and allow complete chest recoil between compressions.
Now let's practice 2 rescuer BLS. Follow the video as you practice. We'll work on the full sequence from the point of finding the victim until advanced medical help arrives. We'll pause here for you to get into position for the 2 rescuer practice.
So another high quality CPR that I mentioned here is to switch roles every switch roles every 2 minutes.
2 minutes,
The compressor will get fatigued. Yeah.
Maybe 1 cycle, right?
Yeah.
5 cycle.
Yeah, 5 cycle. So the first rescuer will be at the side, and then the second rescuer will be at the head. Okay, so when you switch roles, the second rescuer will be at the side, and the first rescuer will be at the head. So it's like like turning here.
Who's count actually?
Huh?
Who's the counter? Who's the
Actually, the compressor has to count. Okay. Later in the later in the video they will teach you about team dynamic, which is a new thing in for BLS. So the first rescuer role is to do a compression, right? So the second rescuer role is to do the AED, right? So another job for the second rescuer is also to encourage the first rescuer to do high quality CPR. Later, that's what I want to see also. Okay, to encourage, you are doing well, you are doing, maybe you can do deeper, at least 5 cm, or the speed, it's like telling your partner in a tactful way, saying that do the compression faster or slow down the compression. Yeah, something like that. I want to see in the later in your skill test. Okay, you all should have take one. Three of you take one, and later switch roles. So that's two rescuer first. You choose one. You all choose who wants to be the first rescuer.
First is do a compression.
Yes, you all choose between.
Sometimes treatment
Okay, let's begin. In 3, 2, 1.
Check for.
Check. Safety.
Okay, say.
Hey, are you okay? Are you okay? Activate the emergency response and get an AED.
And check the. Yes.
There's no breathing, no pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Chest rise.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
here, when you stop for the compression, right, your hand should be hover around, like on top. Not not touching because so that they can see the chest rise. Okay? And now switch rows. Later I'll play again. You want the best one? Okay, I start again. Okay, so start with the scene safety.
Okay, let's begin. In 3, 2, 1.
Hey, are you okay? Are you okay? Activate the emergency response and get an AED. There's no breathing, no pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay, let's begin. In 3, 2, 1.
Hey, are you okay? Are you okay? Activate the emergency response and get an AED. There's no breathing, no pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Encourage your partner also. Okay,
Some of them say seeing the nipple, right?
Actually, actually you're right. They said last time it was in between the nipple,
Yeah.
but now they are saying that it's the lower half of the breastbone. Lower, this one is the breastbone, half, lower half. Okay.
Okay, let's begin. In 3,
Now you can rest for a while first. Okay, now we watch video lah.
Sit down.
No.
Okay.
The next one will be, you also need mannequin also, the next one.
Because most cardiac arrests happen at home or in a public place and not at work, you may not have access to a barrier device during CPR. This means that you may need to give mouth-to-mouth breaths without a pocket mask or bag mask device. Although we won't practice this, it may be a skill you'll need to use one day. This section shows how to give mouth-to-mouth breaths when a barrier device isn't available.
Mouth-to-mouth breathing is a quick and effective way to provide oxygen to a victim. Each breath you take contains about 21% oxygen. When you provide a rescue breath, that breath contains about 17% oxygen. This is why rescue breaths are effective in providing oxygen.
Let's go through the steps to deliver mouth-to-mouth breaths. Start by holding the person's airway open with a head tilt chin lift. With your hand on the forehead, use your thumb and index finger to pinch the nose closed.
Now, take a regular breath and seal your lips around the person's mouth, creating an airtight seal. Give one breath, blowing for about 1 second. Watch for the chest to rise as you give the breath. If the chest doesn't rise, repeat the head tilt chin lift. Give a second breath, blowing for 1 second while watching for the chest to rise. If you can't ventilate the person after 2 attempts, check for an airway obstruction, but then promptly return to chest compressions. Make sure you give each breath over 1 second and deliver air just until you make the person's chest rise.
Today, we've looked mostly at the procedures you should perform when someone does not have a pulse. But you should also know what to do if someone has a pulse but is not breathing effectively. When that happens, rescuers should give breaths without chest compressions. This is known as rescue breathing. For adults, give 1 rescue breath every 6 seconds. Also, give each breath over 1 second and make sure that each breath results in visible chest rise. During rescue breathing, you should also check the person's pulse about every 2 minutes. Because most cardiac arrests
Now we are doing a rescue breathing. The hip.
Get ready. Begin in 3, 2, 1. Give 1 breath.
Any chest rise?
Yes.
Give 1 breath.
Chest rise.
Give 1 breath. Give 1 breath. Give 1 breath.
Watch for chest rise, huh?
Give 1 breath. Give 1 breath. Give 1 breath. Give 1 breath. Give 1 breath.
So how long do we give the rescue breathing for adult? 1 breath every 6 seconds. So, if already, then we count 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000. When you count the 6 1,000, you press. Okay?
If you don't have this back mask, use a mouth.
Yeah. If you have pocket mask, then you use pocket mask. If not, then it's use the mouth to mouth. If you are comfortable lah. If not, they have only hands only CPR.
This rescue breathing, right? Only there is no pulse and
That's how.
they have pulse, but gasping.
Gasping or no breathing.
Pulse, right?
Gasping is
Get ready.
Now I go on to the advanced airway at airport. What are the high quality CPR? How hard? 100 to 120 contractions per minute, and then allow it full recoil, very good. And then at least 5 cm. It's not approximately 5 cm or okay. Then any more? How about the ventilation? Avoid excessive ventilation. Then how about minimize interruption? Less than 10 seconds. Yeah, this one very important. The movement, yes, is 5 seconds. But
Interruption is 10 seconds.
yeah, correct. Yeah, so when you check for the pulse and the breathing is at least 5 seconds and less than 10 seconds. Any more of the high quality CPR? Switch roles, full recoil, ventilation. Yes, okay.
See, like high quality is very, very important. Why? Because mana-mana you ada kan, kalau you ada mangsa, what you ingat saja, I cannot tekan hard and fast. I cannot push the depth up to chest. I cannot buat chest recoil. I cannot push the rate of 100 to 120. Right? And then I mustn't hyperventilate. I must change compressor. Ada orang nak buka, jangan buat sendiri berapa lama pun tak boleh. Kan? Ini saja ingat, you can still save a life. Can you not? That's how you can teach your remember this important high quality CPR. Very important. Okay? I'm going on in that one. Anything you ask, Tika, okay?
Another way to deliver breaths is with an advanced airway. Devices such as laryngeal mask airways, supraglottic airway devices, and endotracheal tubes are types of advanced airways that are more secure for providing breaths. These devices help prevent gastric inflation and airway obstruction. Placing these devices requires special training that we won't cover in this course, but you should know how to give breaths when an advanced airway is in place. When you provide CPR to someone with an advanced airway, the ratio of compressions to breaths changes. Instead of providing 30 compressions in 2 breaths, you'll perform continual compressions at a rate of 100 to 120 per minute, while another rescuer gives rescue breaths. In other words, when an advanced airway is in place, you won't pause compressions to give breaths. This goes for victims of all ages, and not pausing compressions allows blood flow to the heart and brain to remain high.
An opioid-associated life-threatening emergency is one condition that might weaken or stop a person's breathing while they still have a pulse. Opioids are medications used primarily for pain relief. In high doses, these medications can cause a person to stop breathing or can even cause death. Naloxone is a medication that can reverse the effects of opioids and may restore normal breathing. Common ways to give naloxone are intravenous, intramuscular, and intranasal. If you suspect an opioid-associated life-threatening emergency in an adult who is unresponsive and isn't breathing normally but has a pulse, you should give 1 rescue breath every 6 seconds. Then, if your local protocol allows, give naloxone, but do not delay breaths to give naloxone. If the person does not have a pulse, you may give naloxone after starting CPR, but do not delay compressions. For further information on opioid-associated life-threatening emergencies, please consult your provider manual.
Treating cardiac arrest in someone who's pregnant can come with heightened anxiety because 2 lives are at stake. In addition, some rescuers may be unfamiliar with handling the visible anatomy of a pregnant woman. The best outcome for both the mother and the baby depends on BLS rescuers summoning help, providing high-quality CPR, and using an AED without delay. Compressions, ventilation, and AED use are mostly unchanged. If the abdomen is visibly rounded and additional help is available, rescuers should manually displace the rounded abdomen to the mother's left side during compressions to help with blood flow to the heart. More information is available in your provider manual.
So if the patient has advanced airway, so what do y'all do? If the patient has got ETT and the patient needs compression, the breath it will be continuous 1:6 seconds. Do not pause for the ventilation. Okay, then it's for maternity. It's a pregnant. To the left side. Left side, yeah. So.
Why left side? Baby. Why left side?
Later I'll ask them. I think it's like some circulation aspect, something like that. Later I'll inform you again. I'll confirm with them. Okay. So if it's a child and infant, how much breath do we give? 2 to 3 seconds, 20 to 30 per minute. Okay. So now we are going to watch the high performance team.
Another way to deliver What you are about to see will include the portrayal of advanced life support skills. As a BLS provider, you may be on a team with advanced life support providers, but rest assured, those skills are not part of this training. However, no matter the skill, procedure, or equipment used in a resuscitation event, BLS must continue.
Successful teams not only have medical expertise and mastery of resuscitation skills, but they also practice good communication skills and adhere to the key elements of effective team dynamics. Team dynamics is an element of high-performance teams and can be broken down into 3 categories: roles and responsibilities, what to communicate, and how to communicate.
Clear roles and responsibilities should be immediately established by the team leader or the first rescuer on the scene. When all team members know their roles and responsibilities during a resuscitation attempt, the team functions smoothly.
The ideal situation is when multiple rescuers work as a team to perform all the needed roles in a resuscitation attempt. This figure identifies 6 possible team roles for a resuscitation. Note that some roles are typically performed by advanced providers. If enough rescuers are present, each rescuer takes a role. If the team has fewer than 6 rescuers, some team members may be assigned more than one role. Some roles have a higher priority than others.
The compressor assesses the victim and stays next to the victim's chest to perform chest compressions. When giving compressions, rescuers should switch compressors after every 5 cycles of CPR, about every 2 minutes, or sooner if tired.
The rescuer positioned by the victim's head maintains an open airway and delivers breaths while watching for chest rise and avoiding excessive ventilation.
The team member operating the AED or the monitor defibrillator can also serve as the CPR coach. The role of the CPR coach is to focus on team members' performance of high-quality CPR and to provide feedback as needed during the resuscitation attempt.
Every resuscitation team must have a defined leader who assigns roles and makes treatment decisions. Often, the team leader will be at the foot of the victim. However, the team leader may move around to observe and evaluate the skills of the team and to provide feedback when needed.
The timer recorder keeps a record of the events that occur, including frequency and duration of interruptions in chest compressions, time of shock delivery, and medication administration. When only 2 rescuers are present, they typically take the roles of compressor and airway, with one of them also covering monitor defibrillator and team leader. If 3 rescuers are present, They take positions around the victim in the 3 critical roles: compressor, airway, and monitor defibrillator.
Every member of the team should know his or her limitations. Team members should ask for assistance and advice early, not when the situation deteriorates.
I'm getting pretty tired in these compressions. I'm gonna need some help after this.
Sometimes a team member or the team leader may need to correct actions that are incorrect or inappropriate. It's important to be tactful, especially if you need to correct a colleague before they make a mistake.
The next category is what to communicate. Knowledge sharing and summarizing information are critical components of effective team performance. Team leaders should review what's happened and ask for ideas and observations from team members.
That's our second shock. We have 1 milligram of epi on board.
Okay, starting in another 2 minutes.
How about a lidocaine?
Okay, 100 milligrams of lidocaine.
The last category is how to communicate. Closed loop communication is the process of verifying that the message sent was received as intended. It also verifies that any assigned tasks have been completed.
This is our first round of CPR. We have 1 shock on board.
The 1 shock on board.
In addition to using closed loop communication, teams should use clear messaging to help prevent misunderstandings. Teams that work together frequently can create terms or phrases that have specific meaning for them to ensure clarity among members.
So when I'm ready to intubate, what I want you to do is pull that mask off, but keep it handy in case I happen to miss.
Finally, teams need to communicate with respect. Speak to each other in a professional manner, regardless of scope of practice or expertise. Resuscitation events are stressful and emotions can run high. Understand that this is the nature of CPR and remain focused on the life you're trying to save.
So using team dynamic mostly for the ACLS, advanced cardiovascular life support. But we can also use it in BLS for 2 men. Just now I tell you, right, to give a construction intervention. Maybe you can push harder, push faster, or push slower. Yeah, tell your partner and encourage your partner. You are doing good. Okay, you are doing at least 5 cm and 110. You are doing 110 compression per minute. Very good. Yeah. So this is how you communicate with your partner. Okay. There's also a few questions that will be coming up for your theory exam for this team dynamic. Okay. What if there's how do you describe knowing your limits? Anyone? Knowing your limitation.
Mentioned earlier. Mentioned earlier.
Mentioned earlier. Okay. Like
Higher.
yeah. Okay. Very good. Knowing your limitation. I'm very tired. I'm tired.
Change.
Okay. Can change compressor. Okay. Then just now they have mentioned about closed loop communication. Okay. So closed loop communication, how do you perform in a team dynamic? Anyone?
You receive a message. You receive a clear message, so you reply back.
Yes, very good.
Two-way traffic.
Yeah.
Two-way direct communication.
Okay, good. So I'm giving example in the healthcare. Team leader, are you sure you want to give adrenaline? Then the team leader say yes. Please prepare. Please give adrenaline. Okay. Adrenaline is epinephrine. Okay. So this is a closed loop communication. Is to confirm the order, so that they don't give the wrong method, and the recorder the recorder is not recording the wrong thing at the wrong time. Okay, so I want to see the first rescuer become the CPR coach now, encouraging I want to see the second rescuer becomes the CPR coach now, so encouraging and communicate. Any questions?
What you are about to
A high-performing team achieves specific performance metrics, including a high chest compression fraction, or CCF. CCF is the amount of time spent doing high-quality chest compressions during a cardiac arrest resuscitation attempt. You can only achieve a high CCF by eliminating pauses during high-quality CPR.
The Resuscitation Outcomes Consortium trials, or ROC trials, showed that a 10% increase in CCF is roughly equal to an 11% increase in survival. Pauses typically occur during intubation, rhythm analysis, pulse checks, compressor switches, and defibrillation. We'll address some best practices for eliminating pauses in some of these areas, but you'll also need to measure high-quality CPR metrics at your own place of practice to identify other areas where pauses exist. You cannot improve what you do not measure.
Whenever compressions are paused, compressors should hover their hands over the chest and be prepared to resume compressions.
As a BLS provider, you may notice that advanced providers check for a pulse, pre-charge the defibrillator, and prepare to deliver a shock about 15 seconds before pausing compressions at the end of each 2-minute cycle.
Minute 45.
When using an AED, the prompts will instruct you when to pause. For example, during rhythm analysis or shock delivery.
Switch compressors with the second compressor coming in from behind the first. This allows the second compressor to have the same view of the team, and in particular, of the AED or defibrillator. For seamless transitions, switching between cycles every 2 minutes is best. However, if a compressor needs to switch because of fatigue, coordinate the switch to happen as fluidly as possible, such as while delivering breaths.
Stop CPR, switch. Stay hovering. Shocking, everybody clear. Shock, go.
It's a best practice to use real-time feedback devices during CPR. However, if a feedback device isn't available, a metronome can help establish the proper rate. If your AED or defibrillator doesn't have a metronome, you can download a metronome app to your mobile device before the conclusion of this course.
It's not enough to know what to do or even how to do it. To obtain the best results, your team must perform both the what and the how flawlessly. That requires practice, and effective practice requires measurement. But measurement is only effective if you debrief the team, set goals to improve, and practice more. Again, you cannot improve what you do not measure. For more information on how your team can implement this type of program, talk to your instructor.
For 5 minutes toilet break first? Yeah. I realized something, I haven't had y'all touch the AED yet. I'm searching, okay, y'all go for 5 minutes break first. I search for the
video.
Okay, let's begin. In 3, 2, okay, let's begin. In 3, 2, 1.
5, 6.
Now that we're ready,
Okay, let's begin.